masks that will be available to critical infrastructure personnel. And so we've created opened another portal for businesses to request those masks and hand sanitizer for that matter, and then be able to put them into use. We know that these fairly simple steps can make fairly huge differences in outcomes and all the data that we look at. But before we get to that, I did want to update every Hoosier with something that's coming up here this Sunday, and our vaccine plan. Obviously, not just having the logistics in place and the network in place and the supplies, but also a lot of this comes down to communication about where and when and why, how to get vaccinated for the whole state of Indiana, for everyone that is eligible. Obviously, there's an eligibility balance to it all, but that's what we do, and it's working. But that communication part of it is never ending, and we have just begun, quite frankly. So we've gotten to, our most vulnerable, and we continue to move down those across the demographics, always making sure that we're keeping the most vulnerable in mind as we expand that eligibility. And so the Indiana Department of Health, Carpe Diem, seizing the day. You've got a lot of eyeballs on the television this Sunday. I think it's 6:30, but you'll be airing a commercial during the Super Bowl game itself. This is not we're not competing against Doritos or Taco Bell, or you fill in the blank, Corvette, but these will be locally aired in the state of Indiana, and I think the message that will come across is one that's not just compelling, but it will make a difference, a long-lasting difference, and you're going to see a little snippet of that now. As we show kind of behind the scenes what went in to make the commercial that the Indiana State Department of Health will air on Sunday. So if we could we cue that up now?
Got a phone call Tuesday morning by my mom, and she was like, "Hey, do you want to come do a commercial?" She's like, "It's about your dad."
North Central High School's athletic director, Paul Logan, passed away from COVID-19 today.
It'll be a big deal, and I feel like I might as well show up and tell him everything about my dad and how great of a man he was. He was a people's man. Everybody loved my dad. After sporting events, he was always the last one to leave the gym, make sure everybody got a ride home safely. He wanted to take care of everybody. From growing up too, when he taught me how to play football, and I wanted to follow his footsteps in everything. Since he was a high school athletic director, I came here to the University of Indianapolis to study sports management just to see how many people he impacted. It made me want to do that in my life. Everybody's got to wear a mask, stay 6 feet, and just by doing that, it can save a lot of people, and where people don't have to suffer through pain where losing someone in life. I know a lot of people know that feeling. When my dad was sick in the hospital, that was the longest 12 days of my life. Just sitting there not knowing each morning if he's alive. I want to tell people, like, this is serious, and this vaccine will save people.
Well, while Will couldn't be with us today because, of course, he's got football practice, like father, like son, but join us virtually. And we couldn't have said it better than Will. Everyone loved his dad, including me, and had the good fortune of getting acquainted. And Kathy, Paul's widow, is with us today. And Kathy, thank you from all of us here for you and your family, for everything that you're doing and what you're going to continue to share with Hoosiers this Sunday in a big, big way. Thank you so much for sharing this story.
Well, you're welcome, Governor, and thank you guys for inviting us and asking us to join. It was a very heartfelt and very much appreciated on the behalf of the Logan family to be able to do this and get the message across.
Well, your son will. He will this Sunday be the face of the family, so to speak. To about, I think we've counted or predicted about 1.7 million Hoosiers. So double that for the eyeballs themselves. But so many people can relate to your loss, and for you to be able to share your mutual, love, and for everything that you're doing is just means the world to so many, and to be able to continue to honor his memory.
Yes, that was what Paul was about. He was always put others first, always before himself, whether it was the student athletes or the parents or the community. He was always very much concerned on what others thought and what others needed to do. And even though he can't be here right now with us, I kind of feel like this is his way of working through the children. All three of them have done a phenomenal job on everything that they've been asked to do. And I know he cannot be any more proud than I am that they have done a fabulous job. And this is what Paul would want to get out to the community of how important something like this is.
Yeah, the legend lives on, and you're right. He just touched so many people, and will continue to do so. And we're just reminded that, as Will said in that the background there, and we'll all hear, there's so many seemingly small things that we can do that will have such a big, long, lasting impact. And we just thank you so much, Kathy.
No, you're absolutely welcome. Thank you. I appreciate it.
Yep. We'll all see it Sunday together.
Absolutely.
Over and over and over. And with that, we'll go to Dr. Box.
Thank you, Governor. Good afternoon, Hoosiers. More than 11,000 Hoosiers have received their first dose of vaccine as of today. That's an increase of 134,000 from last week. Of those individuals, more than 166,000 have received both doses and are fully vaccinated. That number continues to climb. Since we expanded eligibility to Hoosiers ages 65 to 69 on Monday, more than 144,000 people in that age group have made appointments to be vaccinated. And while some Hoosiers got appointments a few weeks out, others were able to get same-day appointments. To date, more than 875,000 unique Hoosiers ages 65 and older, along with our healthcare workers and first responders, have been vaccinated or have an upcoming appointment. That includes 56% of Hoosiers age 80 and older, 62% of Hoosiers ages 70 and older, and 46% of Hoosiers ages 65 to 69. This number also includes about 63% of eligible healthcare workers and first responders. In addition, nearly 43,000 residents of long-term care facilities have received their vaccine, along with nearly 17,000 staff in these facilities. It's incredibly gratifying to see the overwhelming interest in the vaccine, and it's amazing to remember that just 2 months ago, we didn't have a vaccine. Many of you have heard about the National Pharmacy Vaccination Program that will bring an estimated 20,000 additional doses to our state each week. We welcome additional doses of vaccine in Indiana, but continue to support the state-based system of distributing vaccine to ensure that all vaccination sites are following Indiana's eligibility criteria and to avoid confusion for Hoosiers trying to register for their vaccine. As a reminder, Indiana has created a robust centralized scheduling platform that allows eligible Hoosiers to register using ourshot.in.gov by calling 211 or by contacting area agencies on aging, libraries, or the AARP. I know that many Hoosiers are frustrated that we do not have enough vaccine to give doses open to everyone who wants that vaccine right now. Indiana has more than 2 million essential workers who go to work every day to put food on our tables, keep our lights on, keep the heat on, and to educate our children. All of these individuals have an increased risk of exposure simply because they're leaving their immediate households and engaging with other people so that our society can continue to function. Unfortunately, we also have millions of Hoosiers who have underlying medical conditions such as diabetes, heart disease, cancer, kidney disease, or dialysis that puts them at a greater risk of severe illness from COVID. Our Vaccine Allocation Advisory Committee is a fluid group that is constantly studying what we know about this virus, how it's spreading, and who it kills. But so much depends on how much vaccine we receive and the response of eligible Hoosiers. As long as vaccine supplies remain limited, we will continue to prioritize individuals who are most likely to be hospitalized or die from COVID-19. As we have mentioned several times, people age 60 and older account for 64% of our hospitalizations and 93% of our deaths. Dr. Weaver and the advisory committee are also studying when and how to prioritize people with specific health conditions, such as individuals who are undergoing renal dialysis, those who have received a solid organ transplant, and people with sickle cell disease. Moving forward, the committee will examine the data to determine at what age the risk due to age starts to equal the risk of our other comorbidities, like obesity and heart disease. This will help inform our vaccine eligibility categories going forward. We have relied heavily on data throughout this pandemic, monitoring our positivity rate, case incidents, and deaths to inform decisions about how to best keep Hoosiers safe. We continue to see improvement in our positivity rate. Today, it stands at 7.7%, which continues its downward trend of the last few weeks. We also have seen a decline in the number of Hoosiers hospitalized with COVID symptoms. About 1,600 Hoosiers were hospitalized with symptoms of COVID as of yesterday, down from about 1,900 last week. Our daily hospital admissions have fallen below 200, down from a peak of 526 on December the 7th. Our color-coded county maps also continue to improve. This week, just 4 of our 92 counties are in red on the 2-score map, down from 5 last week. 3 weeks ago, 73 were in red. We also have 29 counties in yellow this week, a significant improvement from the 8 that were in yellow last week. It's incredibly encouraging to see this change. Our advisory map, which indicates the level of restrictions that counties must follow, shows 78 counties in orange, up from 58 last week. Only 7 counties are in a red advisory level, while another 7 have moved to yellow. As I've cautioned before, these changes do not mean that we are out of the woods. Even as more Hoosiers receive their vaccine, we are still very limited in the number of people we can vaccinate due to national supplies. We will not achieve herd immunity for many months, and the new variants of the virus that are emerging will require us to remain vigilant about masking, social distancing, staying home if you're ill, and getting tested, and then following guidelines for isolation and quarantine. To help with this, we will be making approximately 3 million KN95 masks and hand sanitizer available to our frontline workers. These are those workers identified as critical infrastructure through CISA and include transportation, food service, and utility workers, along with about a dozen other groups. We also will be sending similar packages to schools. These will include more than 1 million KN95 masks for teachers and staff and about 600,000 children masks for kindergarten through grade 6, as well as more hand sanitizer. Both of these processes are expected to begin next week. We will be sending out information to businesses so that they can place orders, and will be contacting school districts about delivery options. We also will be providing BioNext Now antigen test cards to schools to help them test symptomatic students and teachers in this package. These tests require a nasal swab that is applied to a card, and then reagents are added. If the student or teacher is positive, the school will know immediately, and this will allow a school to more quickly isolate the positive individual and reduce the spread of COVID. We'll be providing detailed guidance on the use of these cards to our schools very soon. If a school does not want to use them, we ask that they send the cards or take the cards to their local health department instead. We also will be making changes to our definition of a close contact for classroom exposures only. Data from individual schools in the state and across the U.S. indicate that it is rare for student infections to occur from exposure in the classroom when all parties are masked. That data shows only about 3 to 5% of infections occur in classroom. Throughout the pandemic, we have defined a close contact as someone who is within 6 feet of a positive case for 15 minutes or more. Those individuals have been required to quarantine for 14 days. As we have talked with schools, we have found that the majority have only been able to achieve a distance of 3 feet to 4 feet between students and classrooms. This has not resulted in increased cases, and schools consistently are reporting very little transmission within the school setting. One school district in southern Indiana reported that nearly 98% of more than 1,900 students who were quarantined never became ill, and that nearly 3/4 of staff quarantines were due to exposures that occurred outside of the school setting. We've weighed all of this data, and as well as the burden that a 14-day quarantine and contact tracing have placed on our school systems, and we'll be making the following changes effective Monday. We will no longer require quarantine or contact tracing if the students and teachers remain at least 3 feet apart and are wearing a mask at all times in just the classroom. I want to emphasize that this is for the classroom setting only. It does not apply to lunch, athletics, band, orchestra, choir, or any other school setting where students may gather, nor does it apply to classrooms in which students have been allowed to remove their masks. We also are adjusting our approach to quarantine timing to reflect the new options offered by the CDC. We at the Indiana Department of Health continue to support the CDC stance that the safest quarantine is 14 days because only 0.1% of individuals will become symptomatic or positive after that length of time. But we will allow the other two options that the CDC has offered, provided certain conditions are met. The first is to allow students and teachers to return to school after 10 days, provided that the student or teacher never develops symptoms and that they are very fastidious about wearing their mask at times, all times, when they return to school. Another option is to allow a student or teacher to return to school after 7 days if their PCR, so gold standard nasal swab on day 5, 6, or 7, or an antigen test, which could be the Bionex Now card test upon return to school on day 8, is negative. Again, this presumes that the student or teacher never developed any symptoms and that they will wear their masks at all times when they return. We will be sharing this guidance with our schools this week. Our goal throughout this pandemic has been to support our schools and protect our students, teachers, and staff as they continue to navigate in-person education. We hope that these steps will help to decrease the disruption that COVID-19 continues to cause in our educational system and lead to quicker isolation of positive individuals, which will reduce the spread of the virus. Finally, I want to talk about our death rates from COVID. We are still losing too many Hoosiers to this disease. Today, we reported 36 new deaths. Since day one, we have been committed to collecting and studying the data and ensuring data integrity so that Hoosiers can rest assured that they are getting the accurate information. To that end, we recently completed a year-end audit of our COVID-19 deaths. Please understand that never before have local and state departments of health had to present data in real time before it was fully vetted. This audit required matching of every death certificate that indicates infection with COVID-19 as the cause of death or a contributing cause of death to a positive COVID-19 test. We're also working through death certificates from late December and January of this year that came in following the launch of our new birth and death registry system. As a result of this audit, we have identified 1,205 additional COVID deaths from 2020 and 302 COVID deaths for 2021 that will be added to our dashboard tomorrow. As a part of a separate analysis, we have identified an additional 90 deaths that will be added to our long-term care dashboard. These deaths had already been accounted for in our overall death totals, but had not specifically been assigned to a long-term care facility. They will be added to the long-term care dashboard when it updates next week. These are heartbreaking numbers that show us just how devastating this disease can be for families like Logan's and so many other Hoosiers across the state. So please, mask up, get tested if you're sick, and if you're watching the Super Bowl this weekend, do it safely by gathering virtually or only with members of your own household. If you're going out to watch the game, wear your mask, practice social distancing, and make sure the venue is taking steps to prevent the spread of the virus. Avoid using public restrooms during high traffic times, such as halftime. And keep in mind that shouting and cheering allows the virus to spread more easily. We all have the same goal in sight, to get through this pandemic as safely as possible.
Thank you. Also, on deck, we've got, from OMB, we've got Chris Johnston, and we've got Dr. Dan Rosiniak, and we have Steve Cox with Homeland Security to answer any questions that folks may have. And with that, Rachel, let's get at it.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Good afternoon, Dr. Box. A couple of questions. Dr. Box, how do you, going forward, how do you keep sort of that balance between the numbers going in the right direction, the cases dropping, but at the same time making sure we don't surge again? Because once again, people think, hey, the vaccinations are out, so I can go out and do what I need to do. And Governor, I guess my other question would be for Chris Johnson regarding decoupling and CARES Act's tax deductions. A lot of states are kind of going back and forth on that. Some are closed those tax deductions. Have you folks looked at that?
Oh, yeah. Yes, we have. Chris, I'll buy you some time, but we have dealt with it, yes, and we will deal with it. But Dr. Box, you want to take the first one?
Sure. Hakeem, I think that's a great question. When we look at this, we've known all along if we were willing to wash our hands, socially distance, wear our masks, and when we're sick, stay home and get tested, that we could really decrease the spread of this virus. There is, of course, the concern out there about the different variants, particularly those variants of concern. We know Indiana has the UK variant here, the B117 variant, and we know that that spreads much more easily. I fully believe that if we continue to do these mitigation procedures, continue to wear our masks, continue to social distance, I think that there's going to be this feeling that, well, I've been vaccinated, so now I can let my guard down and not wear my mask. The CDC is very strongly recommending that we continue to do that and that we can continue to quarantine, that if we get exposed. And the reason for that is that there'll be some people, about 5%, that vaccine may not take with them. They may not form the antibodies that they should. We don't have near the amount of herd immunity that we need in our communities right now. And we do not know exactly whether individuals who have been vaccinated might still not carry the virus around in their nasopharyngeal area, and they themselves may not get infected, but they could potentially infect others. So it is a time to be very cautious. Grandpa's been immunized. I think it's great to see them. I think it's great to socially distance. Still, if you're inside, I'd wear your masks. I'd avoid those big hugs and the kisses that you want to give them for a little bit longer till we have fewer people that are infected with this virus. But we're certainly moving the right direction, and I believe that we can stay there, sir.
Chris, you want to take a crack at Abdul's second question, and I can follow up on both?
Sure. Thank you. Abdul, as you mentioned, this is a provision that was included in the federal legislation that was adopted or enacted late in December of 2020, which would potentially impact the reportable taxable income by entities in the state of Indiana. It is something that the Department of Revenue is starting to analyze, and I think it's something also that we'll be asking the economic forecasting firm that helps us with the revenue forecast that will come out late in the session in mid-April to assess what that impact would be. But it is something that we're starting to take a look at, and right now it's really just looking at the potential ranges of what that impact could be.
Yeah, and I think in terms of, Abdul, your first question and what Dr. Box shared is kind of, I go back to the serenity prayer every single day, I think, and that is we need to control what we can control. And we know these small steps can make a big difference. When I think about later this month and March, there's a couple things that converge. Hopefully, new vaccine is out. And when when we read the reports about J&J, and could be mid this month, late this month, but that could be a huge boost in and of itself. But then you've got these various different variants coming all toward March 2, which just underscores we need to continue to, well through March, doing what we're doing, because it is working, and we're all in this together. In terms of your second question, I mean, Chris just nailed it, and we'll obviously be able to look at that April forecast and make decisions. Our economic indicators continue to also, likewise, no surprise, when you're balancing lives and livelihoods, we're tracking in the right direction there as well. We'll get some new revenue numbers out before April, and that will inform us, but then we'll be looking at March before we even get to April as well, to be able to fund what we need to fund. But we're in a very unique position here in the Midwest, and we aim to continue to get stronger. It's also worth noting, not to filibuster here, but it's also, I think to go back on something, Dr. Box, that you shared there at the end, and making sure that, as we have before, we're going to, this isn't going to be the last time we audit. And by the way, I would suggest every 49 other states continue to do regular audits as well, because we're all learning a lot, over this last year, and going forward. It's also, though, keep in mind, I was reminded in an article I read yesterday that so far there's been 3 seasonal flu deaths this season. You said, if you rewind the tape and go back about a year, you reminded me that on average, a 5-year average, we were at about 154 flu deaths a year. And this season we're at 3. And then when you talk about RSV, which you might kind of go into, because this is extremely important on both ends of the spectrum of life.
So respiratory syncytial virus is very, very deadly for especially our premature babies that are born. Contributes significantly to our infant mortality.
And it's almost, this is not a medical term, but non-existent. I mean, it's significantly, drastically reduced, probably because of
masking, washing our hands,
all these practices. So when you think about in terms of, 154 down to 3 and RSV dropping as it has, I mean, there's some silver linings in this about the steps that we're taking.
Lindsay with WTWO.
Afternoon, Lindsay.
Good afternoon. How are you?
So far, so good. How are you?
That's really good to hear. I'm good. Having a lot of coffee today. But my question for you is, are we at a point where we have enough vaccine to vaccinate those who are eligible that would like one?
The answer is no. No, far from it. I mean, but moving in the right direction. Fortunately, we have the infrastructure in place. We need to continue to communicate the positive difference that this has in the whole equation. It's one of the factors in the equation. But you might, Dr. Box, just go back about, how we're continuing to step down into the most vulnerable, that would answer Lindsay's question about how far we have to go just within our most vulnerable populations.
So we have received a little bit more vaccine per week allocated, which is, I think we're up to around 100,000 doses now, which is good, and we'll make very good use of that. But it still doesn't come close to the amount of vaccine we need if we went to all critical infrastructure workers, for instance, which is 2 million plus, or all individuals that have comorbidities. So it really is about taking these smaller 5-year chunks right now to make sure that we have the vaccine, so that when we make appointments, individuals can get the vaccine. We have lots of sites that can add many, many more appointments and take many more clients to get the vaccine. But unfortunately, we just don't have the vaccine to do that. As we go forward and we continue to look at this, get down to 60, where we've, basically accounted for those 94% almost of deaths and 64% of hospitalizations, then we start to look at each of those 5-year increments. What is the risk of just your age alone as opposed to other comorbidities or health issues you might have? For instance, individuals who are on renal dialysis or who have had a solid organ transplant, individuals who have sickle cell disease. We know they're at much higher risk. So starting to compare their increased risk based on their particular comorbidity to the risk of just being a particular age, and adding those comorbidities in. And then eventually starting to look at more widespread comorbidities like things like obesity and diabetes and high blood pressure.
Yeah, and I mean, I always try to keep things in perspective. We could have been in a scenario, Lindsay, of we don't have a vaccine yet. That would have been the typical scenario we'd find ourselves in right now, and we'd be talking about this for another 8 years.
We had great fears about that, too.
Yeah, everybody, globally, and so right now, it's not like someone's hoarding it, we all need more of it, and that's not just every state and territory in America, but around the world. The good news is we're getting it in arms. When we get it in arms, and we get it in the most vulnerable arms, and it's going to make a difference. And we have a system that's pretty simple, whether you go online and get it scheduled. Got a company, Zotec, who is scheduling hundreds of thousands, by the way, some in a day. We did about 129,000 or something for the 60 to 65 to 69-year-old group in day one. Phenomenal turnout. Or call 211 and get scheduled. And then we're getting, reports of, and I know it's not flawless, but we're working our way through this. But I mean, we're getting reports of folks that could, literally go through your local donut shop drive-through. If you're one of those people that wants to go into the BMV branch and get your license renewed or your plates renewed, you can do that, and you can go get vaccinated, and you can do it all in 30 minutes, all of that. So this is I'm getting reports of I was in and out in 7 minutes. People couldn't have been more professional. So we've got the system or the network that's in place to accommodate the supply and demand that we get.
Lindsay with the Indianapolis Business Journal.
Afternoon, Lindsay.
Good afternoon, Governor. A couple of questions. First, what was the cost of the Super Bowl ad, and not just what it cost to air it, but also the cost to create it? And then again today, we saw a gathering of people at the State House not wearing masks. State police asked them to put masks on. Some of them did, some of them didn't. Some of those that did took them off when state police walked away. So why are you not directing state police to remove these people from the building when they're not complying with this order?
You may want to weigh in. It's on cost, but let me just say this as an overview. I can tell you. I think to air it was about $123,000, and worth every single penny of it. The CARES Act dollars that we used contemplates communication, that when, where, how, why we need to get vaccinated. And I can't think of another annual event that you would have more eyes on than a Super Bowl. And to be able to do it at that cost, just targeted locally, is a very effective way to communicate. And probably
Reaches a little different population, too. We're having women get vaccinated.
She's talking to me right now.
We have women getting vaccinated at a higher rate than men, and part of that's because of health care and age. But really, we want to make sure we reach everybody where they live, work, and play, right? And we know that a lot of people like sports, so the Super Bowl is a perfect place to do that. The cost is a part of our overall cost with the company that we've signed to do a lot of our communication stuff. So there is a contract with that, which I don't know the exact number for that. I know the original cost was somewhere between $3 to $5 million, but that may have changed since the last time I looked at it. I would be happy to get that for you, though, and send that.
Yeah, I would just, again, stress, Lindsay, that there's in any analysis, there is the cost of your infrastructure, there is the cost of the product, the cost of the expertise. Again, CARES Act, I've been very blunt about this in my expression of gratitude for the support that we've to date received. And part of it is making sure that we're communicating. I talked to the task force coordinator, Jeff Zients, 2 days ago, and we talked about what was working here, and we talked about also communicating and trying to encourage more people. And I don't know of anything more compelling than Paul's message that you'll see on Sunday, and I don't know of any other message that will be seen by more people. So I won't belabor that point. Your second question, Lindsay, State House, you're right. We will, I mean, I don't want us to be hall monitors, but unfortunately we have to make sure that we're stressing the why masks are required and as a policy in this building. We'll continue in this building, as in others, taking a education approach. And what we don't want to see happen is, and by the way, they came into the building wearing the masks, then they took them off, then they were asked to put them back on. So that's where the kind of hall monitor comes in. But what we don't want to have happen is they're there for business that's being conducted by the House and the Senate. This is part of the legislative process, and we want people to participate in this process. It's their business, and we want them to obviously do it safely. And so, yes, we have communicated to the leaders in both the House and the Senate that we're here to help and get the message out that we want more people to participate, but we want them to do it safely. So we'll continue to educate along the way.
Joseph with WFIE.
Good afternoon, Joseph.
Good afternoon. Just had a couple questions for you all today. I know last week Dr. Weaver mentioned a pilot program for getting COVID vaccines to homebound Hoosiers. Wanted to see if you could give us an update on where those efforts stand and what the state is doing to support ambulance services, whether that's financially or any other resources they might need for all of that. Second question is about our Indiana teachers. I know many teachers are wondering when they might be added to the line to get the vaccine. Have those discussions started, and when might teachers be notified that they'll be eligible?
Yep. You want to take
The homebound?
Yes, sure.
Sure.
Yep.
So, I'm very excited about this program. Dr. Michael Kaufman, who is part of the Department of Homeland Security and an emergency room physician himself in charge of EMS across the state, and Dr. Jen Sullivan, our secretary at the FSSA, have worked very hard to put this together. And we have been basically collecting names of individuals that are truly homebound, meaning that they really, after a series of questions, don't have the ability to get out. They don't even really go out to their appointments to be seen. So under those circumstances, we're keeping track of those per county. And then as individual local health departments have doses that are left over at the end of the day, our local EMS are engaged in this process, and paramedicine individuals of actually picking those doses up and then taking them to the homes of these homebound individuals. And there'll be a portal where we can actually have these names and kind of check off as we get each of these individuals done. So I'm very excited about it. I think the original plan was to go with more of a pilot program in just one region of the state, but it has gone so well and so many people have stepped up to help out that basically we'll be, I think, going live with this next week, provided everything continues to go the way we believe it will. As far as reimbursement, I know Dr. Kaufman has said that a lot of the paramedicine and EMS individuals are frequently called to homes of individuals that are homebound or have multiple underlying comorbidities and problems. And so this is a population that their local EMS oftentimes knows very well. So most of them will be just doing this out of the goodness of their heart because they're serving their community. We do, however, have in place the ability through grants for local health departments and other individuals to hire EMS to be at their sites, to not only be there for emergency services, but also to be there to actually vaccinate individuals so that we can reimburse our EMS across the state.
Yeah, and I would say, Joseph, in terms of what do we say to teachers is we are trying to be as clear as we can about how we articulate our path going forward. That being that we are looking at the folks who are most at risk of dying and or being hospitalized. And that's why we started, you heard Dr. Box earlier, cite 93.7 or about 94% of our deaths come from only 22% of the cases, that being 60 and older. And so we're managing the spread, but we're trying to really slow down the deaths and save lives. and hospitalization, that rate. And so that's why we've started with 80 plus, and then we dropped it down to 75, then we dropped it down to 70. So now it's 70 plus, and that's a big population. Now we're into 65 to 69. That's a 357,000 population. You see, I mean, this chart kind of says it all. And this is a good, I mean, you see the numbers. Now there's millions of people who are, you know, going to work every day that want vaccinated, and we want them to be vaccinated. So the faster we get it, and the more that we get, the more that we'll work down, not just the age group, but as you said, you might repeat yourself just briefly, 4 or 5 sentences, about that 5-year increment plus comorbidities and how we will calculate, you know, going forward, because it adds up fast. Just the population numbers.
So the literature really does break down different disease entities, as I mentioned earlier, solid organ transplant or renal dialysis, or individuals that are getting ready to start chemotherapy, other people that we know have a much higher risk of these severe complications. And so we start to look at those comorbidities, and as we continue down with age group, we will be adding in comorbidities so that we make sure we are including those individuals. It may even be a young individual with congenital heart defect of some type. Again, the literature tries to really look at these and say what increased risk each of these particular areas have, and Dr. Weaver and her committee are looking very closely at all of that data.
Yeah, and as you say, and Joseph, as you said earlier, your task force meetings are ongoing. Fluid was your word, but it's not like you meet once a month,
No.
huddle up, and then and go away. It is weekly, multiple times you're talking, and then before you make these formal
Ongoing
decisions.
conversation.
But this is the chart as we work down those 5-year increments with comorbidities now being added in as we kind of look into the future, that will continue to save lives and reduce hospitalization rates. In addition to what we're doing, masking up, physically distancing, washing our hands, all those proper procedures we should all be following.
Sherry with the Indianapolis Star.
Afternoon, Sherry.
Good afternoon, Governor. Good afternoon, Dr. Box. I have 2 questions. One is when you look at vaccine uptake on the vaccine dashboard by demographics, it looks like there are certain groups, most specifically Black Hoosiers, who are not being vaccinated at the same rates as white Hoosiers are, certainly not reflective of what you see in the population. So my first question would be, what is being done to attract Hoosiers, minority Hoosiers to vaccine options, obviously, as they're eligible? My second question is the number of average tests performed per day has gone down, obviously, as has the number of positives, but what is there sort of a sense of, are we testing enough? Would we like to see, you know, people may be getting complacent and just sort of thinking, oh, there's no way it's COVID. Is there a sort of target number for what we would like to see about daily testing numbers, and are we there at this point?
So Indiana's testing numbers continue to compare very favorably to all the states around us and to the U.S. average. I do believe, though, that this is part of one of the reasons we're talking about testing for schools, because if students want to test back in to school, teachers and staff, if individuals wanted to come back sooner than that 14 days or 10 days, certainly getting tested 5, 6, or 7 with the PCR, that's kind of what we consider the gold standard, is a very acceptable way to do that, and then return on day 8. So I'm going to continue to encourage Hoosiers that are symptomatic or are close contacts, if they have concerns, that they get tested, because I think that's very important. We do have many of our universities and colleges going back, you know, just in the last week or so, or 2 weeks. So, you know, I do have concerns that we'll start to see more exposure and more potential cases out there in our younger age group again.
And we have, before you move on to the demographics and making sure that we're communicating, and mobile units, and, you know, even what the feds are contemplating doing to assist, making sure we're getting into our brown and Black communities and encouraging them to get vaccinated. But also, what shouldn't be lost in the conversation about tests is, you know, a few days ago we had 47,000 tests administered across the state of Indiana, and then, you know, yesterday we had 29,000. So that does fluctuate for sure, but the bottom line is we have the capacity to test more. this is, we'll continue to communicate, but it's not like we've pulled back capacity to test. Just the opposite, quite frankly. And so, yes, it will, to your point, Sherry, it does kind of ebb and flow through the week, quite frankly. And we'll be tracking, to be sure, as more and more people get vaccinated and feel as if, that we'll see a relationship between those two numbers as we go forward. You want to talk about some of the,
Sure.
not just investments, but real action that's occurring.
So a big part of the communication plan has been an ongoing, regular meeting with our team at the Department of Health, with the Minority Health Coalition, and other stakeholders throughout the state, really advising us on reaching those racial and minority populations with messaging that will actually resonate with them and what will actually mean something to them. And engaging African American and Latinx leaders from all over the state, even individuals in other populations, to make sure that as we engage them, we get video of them getting their immunizations, we get testimonials from them talking about the safety and the efficacy of the vaccine, and then working to get that messaging out as we go forward. The initial part has been the bigger communication plan, and now honing down further. But more importantly than that, we're very strategically picking federally qualified health clinics, community health clinics in areas where we know we represent lower socioeconomic and different racial populations, whether that's rural or urban areas, and the importance of making sure that the ease of testing is there has been critical. As we work with our pharmacies, we've strategically placed many pharmacies across the state in areas where we know it's an easy reach for a population to get to that pharmacy. And I believe, I hope that we've been told that with the federally qualified, with the federal pharmacy program, we'll be able to engage with them and to further delineate and identify areas that we really would like to have these pharmacies located, again, to make it easier for individuals. We do know there's still significant vaccine hesitancy. Dr. Kane and I talk on a regular basis, and she said it's just going to take some time and education, and it's going to take them seeing other individuals getting vaccinated. When you look at numbers, when you do all of your healthcare individuals first, we knew that there would be fewer African Americans in that group. When you look, unfortunately, at the very older populations, because African Americans die at a higher rate because of diabetes and hypertension and heart disease and other things, there are not as many African Americans alive at 85 and older or 80 and older. So we'll be catching up to that in our lower age groups now, and hopefully with the continued communication and education efforts and the trusted individuals across the state speaking up for the efficacy and safety of the virus, we'll see more uptake in these populations.
And with current publishing.
Afternoon, Ann.
Good afternoon, and thank you for taking my question today.
Sure.
As we move forward with the vaccine, there's been a push by some to begin vaccinating certain groups that aren't based on age, such as teachers and those who are younger but have medical conditions that might make COVID more dangerous for them. Could you provide a bit more detail about how you will determine who is next for those vaccines beyond the age groups? And how do you respond to those who are really frustrated because they thought they'd be at the front of the line for a vaccine based on the CDC recommendations, but they still don't quite know when they might be able to get one?
So you want to align maybe expectation with that eligibility and availability balance, and in starting with the 5.4 million Hoosiers who are eligible ultimately. How do we step back and address it from the at most at risk of death and hospitalization first, and work our way down to the most healthy among us?
Right. And I think it's important to look, as you say, the availability, right? We're now have just now worked up to 100,000 doses a week. And if we would open it up to everybody in the critical infrastructure, that's over 2 million people. We don't have the vaccine doses to be able to do that. So our goal, and we knew when we got this vaccine that there would be a time when the vaccine would be scarce. And when you look at that and you decide how best to allocate that, how do you ethically allocate that at a time when a resource is scarce? is something that's the reason we involved ethicists and we involved clergy and we involved experts in immunology and vaccinology and infectious disease. That is the reason that committee was started months and months before we knew we would have a vaccine, so that we not only had the academic researchers to look at the data to tell us, and when we look at individual comorbidities, what are the highest risks? It was clear from the data, from the evidence, from the research, it was age. And so that is why we started with the age. And Indiana's data has backed that up. But we also now are starting to look at other comorbidities. And when the age risk starts to equal the risk of a particular comorbidity, that is how we are starting to add those comorbidities back in. As I mentioned, we're already working with individuals around patients that are receiving dialysis, individuals that have had solid organ transplant, working to get recommendations from oncologists, from cancer specialists all over the state as to which cancer patients would need to be prioritized, working with IHTC, the thrombosis and hemophilia group here in town that basically deals with our individuals that have sickle cell disease. So all of those things go into making these decisions, and they are evidence-based, research-based, academic decisions at a time when the resource is scarce. I do also want to say that always our critical infrastructure, which our teachers would be included in that, has always been in phase 2. When we had to first put in a preliminary plan back in October, we talked and walked through many of these things knowing that vaccines would be scarce to begin with. And the critical infrastructure was phase 2. We are still in phase 1B, our vulnerable populations.
Yeah, and I would just, not to belabor the point, but I would add that if you look at the total deaths in year 2020, it's about 78,000. If you look at the 5 years, 2015 through 2019, the average is about 65 to 66,000 a year. 78,000 last year. You can see the difference is about the exact difference of COVID. And so how do we reduce that 10, 11, 12,000 deaths that otherwise probably would have been more consistent with 65, 66,000? So that's where we're starting, is how do we save lives and who is most at risk, and work our way down to, again, the most healthy, strapping 17-year-old that wants it.
Rich with WTHR.
Rich, afternoon.
Hello. It's my understanding that we have a backlog of several thousand families waiting for death certificates in Indiana. Can you address what the backlog is, why there's a backlog, and what's being done about it?
Yes, I can. Indiana instituted a new death and birth registry over the weekend of New Year's Eve. So basically on January 4th. I would never have chosen to start a new birth and death registry in the middle of a pandemic. But there was a particular thing called Adobe Flash that was going away. So our old system, Genesis, had that as a part of it, and Genesis was no longer going to be functional or working. And we had been working for over a year to put into place the new Drive system. We have had issues, and the biggest problem you're talking about is that there were a few deaths at the end, and it's not thousands, it's actually 900 deaths at the end of 2020 that we have had issues getting that to come over into our new registry in 2021. So we are in the process, we've been going through those one by one, but we are now in the process of instructing our funeral directors and local health departments across the state to actually take those from the old system and start a new record in our new Drive system, which we believe will help to clean those records up so that families can have the proof that they need that their loved one unfortunately has passed away. It's also important to note that out of those individuals we had signed up in Drive or in Genesis, our old system, to be providers to sign off on births and deaths, only about 32% of those individuals have signed up in the new drive system. And that is despite months, and I'm going to tell you months, of reaching out to providers and telling them every time they got in and certified at birth, certified at death, hey, this is going away. You need to sign up for the new system. We have sent emails. We have sent letters. We have asked PLA to blanket every provider out there. I've worked with the Hospital Association. I actually have gotten lists of providers from Genesis that were signed up that are not signed up in the new system, in the drive system, and reached out individually to hospitals and say, for instance, you have 625 people that were signed up in the old system that are not signed up in the new system. Granted, some of those people may have left, but many of those need to be in the new system, and that is another stumbling block. So we have done over 16,000, I think 15,000 now, birth and death registries in the new system. It works, and the people that actually it now have had further training on it, and they love it. I mean, they say it works well. We have a few kinks to work out, but what we need to do is get through this backlog of tickets and questions, but most importantly, those that were left from 2020, and we have a path forward for that now.
Brenda with Western Wayne News.
Good afternoon, Brenda.
Good afternoon. Can you hear me?
We can, loud and clear.
Good. Thanks for taking my questions. I actually have two.
Okay.
I wanted to see, first of all, if we're seeing any increase in Indiana in the Miss-C cases in children. And then I also wanted to know about the percent of people, maybe we know, maybe we don't, the percent of people refusing the vaccine, maybe what the top 2 or 3 reasons are as to why they're refusing it.
Well, I was told the other day that the top reason is I just don't want it. So, we do question individuals about that. I do hear people still say, I'm just waiting a little bit longer. I'm not sure that I don't want it. I just am waiting to see a little bit longer how people react with this. We are seeing increase, and I won't say an increased number of cases. We have had and certified 50 total cases of MISC in the state of Indiana. There were an additional 30 that were reviewed but were not found to be MISC cases. You may also remember that the CDC came out with a definition for MISA, which is the same type of syndrome, multi-system inflammatory system in adults, and we have had 1 case of that here in Indiana.
Nikki Kelly with the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Hi, Governor. I wanted to see, first of all, if you have had your vaccine. And then I also wanted to double check 24 states are vaccinating teachers, and every single one surrounding state is vaccinating teachers. I have many of them asking me why you don't value them like other states are valuing teachers. Can you respond?
Well, I disagree with your premise, or their premise, that I don't value them. In fact, I talk to teachers as well who have expressed their appreciation that we're taking care of their, as they would put it, grandmother or grandfather or father or mother, and that they're okay, with the approach of making sure that we're focused on the most at-risk population of dying or going to the hospital and potential of dying. And so it's not a question of whether I value every single life in this state, and regardless of your profession, and obviously I just couldn't disagree with that more. So we'll continue to focus on the most at risk, and the short answer is she ain't authorized me to get my vaccine yet, so I haven't, and won't until she does. And I take that as a good sign, not just about my age, but also comorbidities. I'm blessed in that regard. However, if Dr. Box, for whatever reason, says your time is up, you need to go do it, then I will absolutely get the vaccine. It's not that I'm avoiding it or against it. I'm going to practice what I preach and follow the proper protocol. And I'm certainly not going to jump ahead in line. and take it from someone who needs it a lot more than I do right now.